So I sat here to do my to fill my pillbox today, which was empty. And just as I was filling it, I looked at it, I read it, I looked, thought of all the treatment and all the pills that I'm taking, and then I thought about how amazing it is that I have a doctor who actually um, wants to help me heal and is following me and my progress and is very, very optimistic about it. And started crying a bit, which I think is funny because it's been 4 months, right? You'd think I'd get over it and you'd think I'd accept it, but I just can't. Um, I mean, I do accept it, but it still moves me to tears because essentially, it's not a joke that for 12 years I went to over 25 doctors, and that's only counting appointments. That's not counting walk-in clinics that I went to often as well, because I didn't always have a family doctor, um, or it's you can't see your family doctor for like 3 weeks, a month, 2 months sometimes, and so when I needed them quickly, and and it's not a joke that nobody wanted to help me, and that they told me that it was in my head and that I was crazy, and I didn't know enough about health, so I would think that these doctors could help me, and that I would go and somebody would say, well, obviously you're in a lot of pain, or obviously you have a lot of these health issues, and obviously, and nobody did. And a few days ago, there's a girl who left a comment on my YouTube video, and she talks about how 2 times she's wanted to commit suicide, and both of them were after she'd been to doctor visits. And both of the times the doctors were telling her that it's in her head, that it's psychosomatic. One doctor even threw a box of Kleenex at her face and told her, you're the worst case of psychosomatic behavior I've ever seen in my life. Um, and I can kind of relate to that, I gotta say. I don't know if there's any kind of, if there's worse of an insult. I mean, I'm sure there are, and I don't mean to say this is like the worst ever for anybody in the world, but when you go to the doctor with a health problem, which in itself is difficult because, well, you're suffering, and you're hoping for help, right? And kind of the established medical system, the medical establishment is where we always think to first turn for health. So something's not well, you go to the doctor, and that's what I started doing almost 13 years ago, and time after time, I was essentially denied care, because I was saying I have a problem, and the doctors were saying no, you don't have a problem, or they were saying your problem is psychosomatic, which means sure you have a problem, but there's nothing you can do about it, other than like take antidepressants, probably take pain medication, take anti-anxiety medication. I'm sure there are other like masking medications for it. I personally was never interested in that, so I tried as much as possible to avoid anything that masked symptoms, and I tried a ton of natural approaches that I won't get into right now, but to help myself. And I remember back in 2003, I went to, was that 2003? Yes. I'd just gotten a new family doctor because the one I had was just not helping me at all. And he examined me, he did some tests, and after I returned to see him a few times and kept complaining about problems, and at the time it was a lot of body pain problems, nausea, and headaches. I also had, as I've mentioned before, anxiety and depression, but those were being taken care of. At the time I was taking antidepressants, and I was working on that through a lot of therapy. So what I was complaining about was the pain. And I remember getting into the doctor's office after a few appointments, and him saying, well, I'm looking at your results, you're in perfect health. And then he said, I think you're just biochemically wired wrong. And that hurts me till today, because I remember very, very vividly walking out of his office that day and wondering, You know how they have those pens that are attached to the little rope? Um, I wondered why don't they have like a gun attached to one of those ropes with one bullet for each patient? Because when you tell somebody something like that, that feeling is almost inevitable. Like, I'm broken, something's wrong with me, I'm just not well, and there's kind of nothing you can do about it. Um, and now let me remind you that 11 years later, here I am, and I have a chronic bacterial infection in me. So this doctor was absolutely wrong. And had he tuned into what I was saying, I could have been diagnosed then. Um, Luckily, I'm diagnosed now, so all the insults that I've gotten from these doctor's visits no longer have the same weight, I guess. They still hurt. But I feel like I'm on the losing end of it right now. Sorry. I feel like I'm on the winning end of it right now, while for 12 years I was on the losing end. And as long as you don't know what's wrong with you, then, you know, part of me believed him that I was just wired wrong, you know? And that's just an awful, awful thing. And I wish we lived in a society where when as a patient you go to the doctor, how you feel is actually taking into consideration, that it isn't like you become a child, because essentially that's what it is. You go to the doctor and they now judge whether you're going to get care, what kind of care you're going to get, and if you are actually informed about your health, well, most likely the doctor's going to say, hey, I'm the doctor here, or he's going to dismiss any concern you have. So the arrogance of the medical system right now is something that I think is absolutely destructive to the health of patients like me.